So afternoon, everyone. Nice to be here this afternoon. Thank you for inviting me to join you. So as Claire said, I'm an assistant director at NIHR and I have responsibility for a lot of the commissioning activity across a number of our NIHR research programmes. So in terms of what I'm planning to cover today, we've got an hour for this session, just under an hour. You'll be pleased to hear I'm not going to talk at you for an hour. I've got a few slides, probably take about half an hour, and then want to leave plenty of time for questions. In terms of questions, I think if people want to type in questions as I'm talking, that's fine. And I think colleagues will start to collate some of those equally at the end. Happy if people want to put up their hands. But if you've got questions as you're going along, just feel free to type them in the chat and then we'll try and pick up as many of those as we can through the presentation. So in terms of what I'm going to cover, I'm going to give a very high level overview of NIHR because I know that many of you are aware of NIHR, but what I thought might be helpful was to focus a little bit in terms of what are the NIHR strategic priorities at the moment. So where's the sort of strategic vision from NIHR and where's the direction of travel within NIHR and some of the areas that we're really focused in on. And then spend a little bit of time looking at how we identify areas for commissioning activity and what the process is behind that, and think about and identify where there are opportunities for stakeholders to be involved in that process. So you're all very familiar with NIHR. This slide is just there to remind us it's the National Health Research Funder, established in 2006 as part of the Cooksey Review to bridge those gaps in the translational research pathway. We're in a really fortunate position at the moment. We've got a really buoyant budget. We've got over £1 billion a year to spend on research, which is a really fortunate position to be in. It's an enormous, large, multifaceted organisation that covers everything from capacity building all the way through to working with industry, new drug development, etc. So I think the purpose of this slide was just to sort of highlight the breadth of NIHR activity, and I think probably the COVID pandemic really illustrated, I think, the value of having that national health research funder and how, in times of crisis like the COVID pandemic, NIHR could bring investment, resource, and expertise to really tackle sort of that global problem. And NIHR really was sort of world leading in a lot of the work that it did in amongst the sort of the COVID response and the COVID pandemic. So in terms of NIHR's mission, it's to improve the health and the wealth of the nation through research. And our strategy is Best Research for Best Health, the next chapter. So it's available on the NIHR website. And I'd encourage you to go and have a look at it. The reason for mentioning it today is to highlight that it's there. And essentially, this is the guiding principles behind a lot of the NIHR activities. So if you see calls for research or activity in a particular area and you think, why on earth is NIHR doing that? It will be because it's related back to our strategy. So there are 6 pillars within that strategy. I'm not going to go through all of them today. The one we're interested in today is that first pillar around funding research, but I encourage you to go and have a look at it. It's still a relevant strategy. It's still what we're using, and that essentially is what's guiding a lot of the NIHR activity that you're probably seeing at the moment is that strategy. So within that strategy, within those pillars, there's also what NIHR has identified as its areas of strategic focus. And there's a couple that I'm going to sort of particularly bring to life, hopefully today. So the first one is around building that capacity and capability around prevention. And then the second one I'm going to highlight is around meeting the needs of underserved communities. So that's not to say the others aren't important, but I just, for the purposes of this discussion today, I'm just going to highlight those two. But again, encourage you to have a look at these, because a lot of the research commissioning and investment and activity that NIHR will be doing will be related to meeting their ambitions around these areas of strategic focus. So it might start to give the context as to where some of the things you're seeing from NIHR are grounded in and where they're coming from. So the first one from an NIHR point of view that we're really focused on at the moment, and you've probably seen a number of different things that NIHR is doing to try and support this, is this idea about supporting research inclusion. So if NIHR really wants to meet its mission around meeting the health and the wealth of the nation, it needs to make sure that it takes a very inclusive approach to the research that it funds, and it needs to make sure that NIHR research opportunities are open to all and not just those in particular geographies and particular populations. So what that looks like in practice and how we make sure we're taking an inclusive approach to research, and I think this is important to think about if you're thinking about putting in an application to NIHR, is really demonstrating how you're going to deliver that research inclusion and what are you going to do to support that, and particularly around reducing inequalities. So the first thing we do to make sure we take that inclusive approach is make sure we're asking the right questions. And the way we do that is through a co-production approach. So we want to make sure that we're involving those who use, who plan, who commission services across the health and care system, who are ultimately going to be those evidence users, are involved right at the start in terms of actually picking up and identifying the right questions. And I'll talk a little bit more later in the presentation about what I mean by that. But that's the first thing we do in terms of taking that inclusive approach. We then want to make sure that the research that we fund is inclusive. So just on the bottom left of that slide, you'll see a screenshot that makes reference to the NIHR Include framework. And if you've not had a look at that, again, encourage you to have a look at that. So that really sets out, I guess, the sort of ambitions and principles that NIHR is expecting to see within its applications in terms of how proposals are going to meet the needs of the research inclusion agenda and ways that we can support applicants to do that. And then finally, in sort of we think about closing that feedback loop, again, if we want to be inclusive, we've got to make sure that we disseminate and we share the knowledge that we are investing in. And so again, there's a really strong push at the moment in terms of the NIHR open data, the sharing of research findings, the communication of those. And that's done in a number of different ways through NIHR evidence, but also through the NIHR journals library and the Twitter feed. So it's sort of this continuous cycle in terms of making sure we've got the right question, making sure we're commissioning the right research, and then making sure that that research is communicated and disseminated at the end. So there's a lot at the moment in terms of thinking about those inclusive approaches. But I say I would encourage you to go and have a look at the NIHR Include framework if you've not had a chance to look at it yet. So the other thing we're doing is I think that there's been a recognition within NIHR for a while now that if we really want to foster inclusive research and support inclusive research, we need to create those enabling environments. So it's easy for us to say, oh, we want research to happen in this population or in this geography, but actually in practice, we know that it's a lot harder than that. So we need to think about ways that we can work to really foster those enabling environments and really allow NIHR research to take place where the need is greatest. So this isn't a new thing for NIHR, but I think it's definitely sort of raised much higher up the agenda at the moment in terms of NIHR activity. So it's been around in some shape or form since about 2017 when Chris Whitty and Louise Wood did sort of a tour around various organisations across the UK and made the statement around the fact that NIHR research needs to take place in those areas where the need is greatest. And since then, there has been a whole programme of activity that's gone on to basically deliver against this ambition and support this. We've worked with colleagues across other bits of the NIHR system to start to see if we can map where the NIHR research activity is and where the burden of disease is. There's been lots of NIHR research calls, you've probably seen them, that are very targeted around wanting to have research in a particular geography or population, wanting to see people being brought into that research environment that may have historically not been able to access research in the same way. It's high up on the agenda of the NIHR Strategy Board. There's been a whole programme board that's been set up to support this. And as I say, we've got the Include framework. So again, this isn't going to go away. This is integral now to the delivery of NIHR research. So again, if we're thinking about how NIHR is prioritising the types of research it wants to commission and the areas it wants to commission, then this is front and centre to everything that's going on within NIHR at the moment. So again, if you're thinking of applying to NIHR, I think just really think about how you're going to start to address, or how through your application you're going to address this ambition around NIHR to make sure research is happening where the need is greatest. And these next couple of slides just illustrate what we mean by sort of that, those gaps and that research mismatch, basically. So liver disease as an example is an area that we've been focusing on. So if you have a quick look at the maps, the map on the left is NIHR research activity through the Clinical Research Network. The map on the right is burden of disease, and it's obvious immediately that the NIHR research activity that we have used in this particular diagram, there's a complete mismatch between where the research is happening and actually where the need and burden of disease is greatest. So I know straight away that Wales isn't included in this data. It's been, I think we're in a much better place now than we were when we first had these maps, and we now do have access to data from colleagues in the devolved administrations. The other thing as well, just to say, is that we are fully aware that this isn't a perfect science, and the purpose of including some of these maps and schematics in some of our calls and some of the work we do is really just to illustrate what we're trying to achieve and what the mismatch we're trying to reduce. It's not a perfect science, and we recognise that, but it's a really nice way of being able to show where some of those discrepancies exist between the burden of disease and the actual NIHR research activity. So within NIHR, we've been thinking how we start to address this. And again, you probably would have seen calls that have gone out recently where we've actually taken a slightly different approach and thinking about the fact that it's very well showing maps and saying, well, actually, we want lots more research activity to take place here and not here. But actually, in practice, that's really hard to do. So again, we sort of learned the hard way, and we've had some failures. And what we recognise now is that actually we need to take a slightly different approach to some of this. And we probably need to take a bit of a step back, provide some pump priming investment to enable those networks, those partnerships, a greater understanding about what some of those systems barriers are and how to start to overcome them. So there's been a couple of calls, particularly around liver disease and around palliative end of life care, that have been specifically focused on not funding research, but thinking about how you can start to increase that research inclusion and start to enable research to take place in those areas of greatest need. So really, I think sort of a bit of a pathfinder for NIHR, and it's been really positive so far. And we've had some really successful partnerships, and I think helping us get a better understanding about where those challenges are across the system and how we start to alleviate some of those barriers. The other thing that we've been doing a lot of recently, and again, you would have seen probably a number of different initiatives being advertised through NIHR, is this notion around building a research culture, particularly around public health and prevention and social care research. So again, I think that recognition from NIHR about the need to increase its investment and its portfolio in these areas versus the more traditional clinical research areas. So I'm just going to focus on sort of the public health and prevention in this talk, but happy to take questions on some of the things we were doing around social care at the end, if that'd be helpful. But broadly, again, if NIHR wants to fulfil its mission of improving the health and the wealth of the nation through research, it needs to recognise that the influences on a population health come from many different areas, and it's generally those wider determinants of health that can have a huge impact on population health. So you're probably all familiar with the Dahlgren and Whitehead model about the social determinants of health, but I think this was and is a driving force within NIHR at the moment in terms of thinking about those, what affects a population health and what are some of those, where can we leverage change and where can we start to influence change in some of those sort of wider determinants of health. And as I say, what we thought about was then the fact that a lot of the research that we were funding was quite downstream, was quite focused on individual level interventions. But actually, if you really want to make a change at a population level, you need to go much more upstream, and you need to be thinking about those wider determinants of health. So, we're thinking about transport and air quality and housing. It's those types of things that we need to be thinking about, not just the individual level obesity interventions. As important as they are, there's also, we need to be thinking much further upstream in some of that sort of complex system space. So again, you would have seen a number of calls that probably go out now across the different NIHR research programs, particular public health research program, that really are taking that population level approach. And this is why it's really trying to address those wider determinants of health and think about how actually you can start to improve health at a population level rather than an individual level. And this was grounded in evidence. So when we actually looked at our portfolio, the slide's a little bit old now, but it was quite stark. So when we looked at the funding that had gone into improving the wider determinants of health, so that column on the left is way lower than the column on the right, which was more around the sort of individual level intervention. So again, when we started to look at our portfolio, there was an obvious gap in terms of research that was addressing those wider determinants of health, which was really needed if we are really going to improve the health of the population across the UK. So a lot of work that's gone into thinking about how you can do that, and obviously local government has an absolutely front and centre role in enabling that improvement at a population level, particularly around public health and prevention. They're central to delivery of multiple interventions and support for multiple agencies that help improve that. So again, what we recognised within NIHR was that there was a complete sort of discrepancy between a research culture within an NHS setting versus a research culture within a local government setting. And so again, NIHR thought about it strategically and thought, well, actually, if we really want to start improving population health and addressing those wider determinants, then we need to work with local government and we need to support them. So last couple of years, there's been a targeted investment into local government. So you probably would have seen the health determinant research collaborations. So this is huge investment and a new approach for NIHR where it's investing directly into local government to build that research capacity and capability to enable evidence-based decision making across local government, with a view to then helping improve outcomes basically at a local and a population level. So we're really excited by this. This is a real game changer, I think, within NIHR. I'm really pleased to say that within the last competition for HTRCs, there are now 2 HTRCs in Wales, which is really fantastic. So we've now got 30 in total across the UK. I'm really excited by this new initiative. I think we're already hearing some really amazing stories and work that's coming out of the HTRCs, and I think a real game changer for NIHR. So we're really positive about this and really keen to see where this leads and how we can start to, I guess, sort of build that research culture within local government. And I say that because the HTRCs are different. They're not about funding research, and we've been very clear about this. The investment into HTRCs is about building that research culture, embedding a culture of research across local government. So how do you start to embed research and decision making into your planning decisions, into your licensing decisions? How do you ensure that good quality evidence is available to support those decisions across local government? So that's what HTRCs are there to do. At some point, we hope that they will do research and they can apply into the NIHR research programs, but that initial 5 million investment is really about changing the culture and how they change the culture within local government. So that's the purpose of them. So they're a little bit different to a normal sort of NIHR research project, and that's why we're really excited by them, to see the impact, I guess, that investment will make, and hopefully in a positive way. The other thing we've been doing as well is we've also set up what we've called the first team. So these are intervention responsive study teams, and again, in recognition of the fact that we know that our decision-making timescales within NIHR and our commissioning timescales don't always tie in with the actual realities of day-to-day life and the need for evidence in a timely way. So again, we've now set up, I think, 8 first teams funded by the PHR programme, and they are there on call-off contracts to respond directly to evaluation requests from local government. So any local government, so across the UK, there's a call that goes out a couple of times a year. We can put in applications, and if successful, they will get allocated to one of those 8 teams, and we'll do that more sort of rapid evaluation piece. So again, it's really there to support colleagues in local government and that decision making, and I think more of a recognition about the timescales and that evidence needs can't always wait 5 years while we go off and do a nice RCT and then come back, by which time the world's moved on and the findings are no longer relevant. And then just lastly, in terms of sort of, I guess, this piece around prevention and public health more generally, obviously, if we want to start to really sort of build that culture of capacity and capability, we need to have that talent pipeline, and we need to have the research leaders of the future coming up to enable to drive this agenda forward. So again, there was a recognition that there was a bit of potentially a gap in some of the offerings from NIHR, particularly in that sort of public health prevention space. So a couple of years ago now, we set up the Population Health Career Scientist Award. So hopefully some of you have seen this as well. So again, really to support researchers who are looking to make that step up to sort of research professor and that independence. So really at sort of that stage of their career, it's 5 years funding. It's hopefully a significant amount of money to help them do that. It's a UK-wide scheme, so open to anyone from across the UK. And again, a particular focus on wanting to think about bringing in applicants from sort of outside the traditional public health disciplines. So we're really keen to try and bring in sort of, the engineers, the geographers, the planners, the statisticians, mathematicians, etc. So again, those disciplines that might on the face of it not look like they have a health related role, but are really integral to thinking about that population health. So again, that scheme's up and running. I think either the 3rd or 4th round, I can't remember how many rounds we've had now, is going to open in April. So again, if you're at that stage in your career, I encourage you to have a look, and equally, if you've got any questions, feel free to drop me a line, and we're more than happy to have a chat with individuals who might be interested in a particular scheme. So I think it's really, really positive actually, and really great that we've now got that in our sort of menu of commissioning opportunities across NIHR. And then just another couple of areas just to flag quickly, in terms of NIHR priorities, mental health goes without saying, huge priority. And again, there's been a lot of additional NIHR research investment that's going into mental health, but particularly thinking about mental health research capacity in those areas that have historically been underserved by mental health research, particularly NIHR mental health research. So some of you may have seen recently there was a call that went out around mental health research groups, and there was also leader awards and development awards. And this came about from some dedicated investment from DHSC, particularly to think about mental health, but mental health in those underserved areas. And we did a bit of scoping work, and it was quite stark in terms of sort of that mismatch between geographical areas across the UK. And I think the report showed us that there were more psychiatrists in King's College London than there were in the whole of the north of England. And so an obvious game changer there in terms of us needing to put that investment in those areas where the need is greatest. So just to flag that there's a lot of focus on mental health, and there will continue to be as well. So again, if that's an area that's of interest, then keep a watch and have a think about it, because there will be more opportunities, I think, coming out through that mental health research space as well. Because again, it's an ongoing priority for NIHR, as is maternal inequality. So again, picking up this idea about sort of inclusion and reducing those disparities across particular disease areas. So maternal inequalities is, again, sort of an area that NIHR is particularly interested in, and this is sort of slightly hot off the press. I don't know if people spotted this last week, but this was only announced, I think, Friday last week. This is the first NIHR challenge, as it's called. So a new endeavour for NIHR. So it's essentially taking a slightly different approach to tackling a particularly important issue, and this one that we've picked for this first NIHR challenge is maternal inequalities. And I don't need to tell you why it's important. There's plenty of evidence to show that the UK is not in a great place at the moment in terms of maternal outcomes. And the process will be that there will be, at the moment, there's up to £50 million that will be made available for this NIHR challenge. It'll be slightly different, and as much as that investment will be used to fund a consortium. And so what will happen is that organisations will bid in to NIHR to be part of that consortium. There'll then be a selection process to come up with the members of that consortium, probably up to 10. And then the plan will be that that consortium will go away and then come back and start to advise about their sort of work programme and what the areas are that the consortium is going to focus on. So it is a very new approach for NIHR, and some of it's grounded in the approach that was taken in COVID, that if we put significant investment into a particular area, and if we really actually get the system to work together, so bringing together all parts of the system, infrastructure, research capacity, research programs, etc., you can really make a step change and start to really tackle some of these really intractable problems. So this is the sort of I guess the concept behind this idea of an NIHR consortium. So if you've not seen it, I encourage you to go and have a look. There is a webinar on the 18th of March. If you want to find out more, you can sign up for that. And then I think the advert will probably go out. The call will probably open around sort of March time as well. So again, if you haven't seen it, I say it only came out last week, so I can encourage you to have a look. So that hopefully gives you a bit of a feel for some of the sort of key areas that NIHR is focused on at the moment, where some of its strategic priorities are and what it's doing to start to address some of its strategic priorities. The next few slides, I was just going to sort of narrow down a little bit and start to think about, obviously there's very top level priorities and top down sort of influence in NIHR commissioning, but also, for want of a better term, there's bottom up as well. So there are a number of different areas as well that NIHR takes forward in terms of its commissioning. It's not just focused on those very sort of high level, big broad strategic themes that I've just talked about now. And obviously the way that we do that is through funding research, and that's that pillar one in our strategy around funding high quality research. So what does that mean for NIHR? What do we actually do? So as you're all aware, we operate in that sort of evaluation space, that applied health research space. So we're looking at the effectiveness and cost effectiveness of interventions and services delivered across the health and care setting. We're not on the discovery science space, so that's to our UKRI colleagues and other funders, but we're very much in that evaluation space. And the way that we make sure that we're addressing the mission of NIHR in terms of improving the health and wealth of the nation is essentially taking that co-produced approach, as I talked about earlier. And what we do within NIHR is link together those evidence users and those evidence generators to make sure that we're asking the right questions and that we're commissioning high quality research. And essentially, we do most of that through our commissioned work stream, and I'll talk a bit more about that in a moment. But there's obviously also the response mode work stream as well, which is open all the time. And probably goes without saying that we don't just fund clinical trials. Sometimes there's this misconception that all NIHR funds is RCTs. It doesn't. We don't actually mind what methodology people use. We just want it, what study design. We just want the right appropriate study design and methodology to answer the question. So really broad portfolio of different methodologies and studies. There are a number of different research programs across NIHR, and I'm not going to go through all of these one by one, but just to say that they cover across that translational pathway, and there are deliberate overlaps across the NIHR research programs, because if there wasn't overlaps, there'd be gaps. So if you're struggling to think about the remit of a program and struggling to think about, I don't know which program I should be applying to, don't worry. I'll just encourage you to drop us a line, because actually sometimes we have to be quite pragmatic, and sometimes it takes us a bit of time to think about actually what the answer should be. But that is deliberate, because otherwise we'd have gaps. And so again, I think just, get in touch early. And as I say, there are a number of different research programs. If it's an important question that's within the overall remit of an NIHR, we should be able to find a home for it. And please don't struggle thinking about that, where that home should be. It's much better just to drop us an email, and we can give you a steer about where you should be targeting your application. And this slide just illustrates the same thing, that within public health, we have the public health research programme, but there are multiple other programmes across NIHR that fund public health research, all with slightly different remits. So again, take home message from this is, there might be multiple options for you to consider, but if you're unsure, unclear, then drop us a line and we can help navigate you to the right programme. So this is a programme remit. So I'm not going to go through all of them. I'm happy to share my slides, but broadly it obviously goes all the way through from the EMI programme, which sits right on that cusp of sort of UKRI and that sort of more early sort of discovery space, all the way through to health services research and everything in between. So just to reiterate, if it's an important question somebody wants to know the answer to, that's within our overall remit, there should be a home for it within one of the NIHR research programmes. So within the NIHR research programmes, how do we make sure that we're actually delivering against that need? How do we make sure we're delivering against the needs of our evidence users and we're actually funding the right research? So we take what we call a needs-led, science-added approach to everything that we do. And again, if you're thinking about putting an application to NIHR, just think about framing it in that way. So the first thing that will happen to any application that comes in is that need will be assessed in terms of what's the question, is an important question, and fundamentally who wants to know the answer to this question. So sort of who's sat there waiting for the answer to this question, and does it have the potential to change practice and improve outcomes? Then the science bit will come on. So once the need's been established, then we'll worry about the science, but it will be that way around, won't be the other way around. So that's everything that fundamentally sort of underpins an NIHR research activity. And this is the framework that this is sort of driven from, is this adding value in research framework. So this slide's a little bit old now, but it's still very relevant. So it's about that pillar one, about making sure we're addressing high priority questions, and that fundamentally somebody wants to know the answer to the question that we're addressing. So again, if you're framing an application, just be really clear about where that need is, who wants to know the answer to the question, and how your proposal is going to address that evidence gap and that evidence uncertainty. So most of that work is driven through what I say is the commissioned work stream. So this is where NIHR proactively goes out, works with stakeholders, identifies where those evidence gaps are, and then puts out quite targeted calls for research. We tend to think about it as commissioning research where there's market failure. So our sense is if we didn't go out and proactively try and commission in these areas, they probably wouldn't naturally come in through the response mode, because they are most of the time not the big shiny new areas of research. So we fund things through the commission work stream on sweaty palms, on earwax, on things that actually on the face of it might not look like they're the most important questions, but when you start to think about the impact on services, on patient outcomes, quality of life, they're really, really important. So that's what the commission work stream is there to do, is to identify those areas, those key questions, and then proactively go out and try and commission good high quality evidence to support decision makers. So in terms of what we're looking for, so what makes a good commission topic? So first one's obvious, it's got to be important to the NHS, to social care. It's got to be clear and well defined. It's got to be feasible. So there are lots of important questions, but actually sometimes it's just not feasible to conduct the research. And again, the last two pretty obvious, that it's not already been covered elsewhere, and that the outcome will still be important when the study completes. So these are the sort of the criteria that we look at when we start to consider topics and think about whether they might make a good topic for the commission work stream. And on the whole, the commission work stream works really well. It's tricky, it's not always easy to do, but this is just some highlights, some examples of studies that are funded through the commission work stream and have huge impact. at scale. So again, I think it's demonstrates sort of NIHR's USP. Really, it's not probably one of the only funders that really takes this approach to commissioning research, and I think it's really integral to making sure we're asking the right questions that the system needs within the UK. So just narrowing down a little bit more in terms of what do we actually do then? So how do we get those topics and what do we actually do with them, and how do we determine what gets advertised and what doesn't? So how do we develop a research question? So the first thing to say is we get topics that come in from a huge range of different sources, and we get hundreds and hundreds of them per year, as you can imagine. So this is just a snapshot of the types of sources that submit topics into us, but there is a large number. And so there's a lot of work. There's a whole team based in Southampton that work behind the scenes, taking those topics, and we do look at every topic, regardless of source, and think through whether actually it still represents a genuine uncertainty, whether more research is needed, whether it's already well covered, etc., and then start to work through and think about whether it's something that NIHR wants to commission research against. So I think this is just to illustrate that we cast the net really wide at that initial stage and bring in topics from a whole range of different sources. That being said, there is a number of what we call NIHR priority customers. So these are a very small number of key organisations who have a central role in commissioning across the health and care landscape. So in no particular order, they're the organisations that are listed on that slide. So obviously Wales is one of our priority customers. So they have a slightly different route into NIHR and more of a direct route into NIHR. So if, for example, the Welsh Government comes to us and says, we've got a really important research question, we want NIHR to do something with this question, that would bypass some of the sort of usual decision-making processes. So if we get a topic from one of these priority customers, generally we won't reopen questions around importance. So if the Welsh Government says to us it's an important question, it's not for us to go back and ask, well, is it really? So it sort of bypasses a couple of the internal and external processes that a topic would normally go through. So it's just a flag that there is this small number of what we call priority customers that can feed topics directly into NIHR, and NIHR, as best as it can, will pick those up and try and turn them into commissioning opportunities. Then we've already touched on this in terms of what we're looking for, in terms of how we prioritise that research, but essentially sort of what's the evidence gap, the burden of disease, and the impact on the services starts to help us, I guess, make that sort of decision in terms of is it an important topic or subject area that we want to commission some research in. And we have a number of different committees and stakeholder groups that topics will go through. So a lot of programmes have what we call prioritisation committees, and again, colleagues and devolved administrations have observer roles on a number of these different committees. So again, they're made up of those evidence users, so they're generally not sort of academic led committees. They are colleagues who might be involved in commissioning or service delivery. So again, they're the evidence users who are making that judgment call and advising NIHR about whether they're important questions that somebody wants to know the answer to. So again, there's all the details on our website in terms of who's on these committees, what their remits are, but it's just to say there is a very robust internal sort of decision-making process that topics will go through to determine whether their level of importance and therefore whether they need to be advertised from an NIHR point of view. I won't dwell on this, but a lot of that committee decision-making is all framed around PICO type format. So again, if you're thinking about framing a question into NIHR or framing a study into NIHR, really think about the PICO. It's surprising the number of times that you get an application in and you have to read it multiple times and you think, I still don't know what the intervention is. So I think and I know probably most people do, but I'm probably stating the obvious, but just think about framing it in that PICO format, because that's one of the first things we'll look at, particularly if we're trying to think about which programme is best fit. We'll look at the PICO. So what's the intervention, where's the setting, where are the outcomes, and that helps us direct things. But equally, from that committee point of view and that decision-making point of view, they want to hone in right on this type of information. And if they can't even work out what the intervention is, the application probably doesn't stand much chance of being progressed. So we spend our lives thinking in that sort of format of a PICO. And there are opportunities. So I've talked about priority customers, I've talked about sort of where topics come in from and that sort of wide range of stakeholders. There's also an opportunity, so anybody can submit a topic into NIHR at any time. So there's a form on our website and the links there. It's open to anybody, and every topic does get looked at. there's a form that you fill in, and broadly we're just sort of trying to understand from a few questions, and this is slightly different to the web form, but the type of things we're trying to get at is, what don't we know yet? Why is it important? Who wants to know the answer? And then, how would you start to frame that question? So, what population are you particularly interested in? What intervention? So again, just some questions that we use to help sort of guide people submit topics in. But again, if there is a topic that you want to submit into an NIHR, then please do. That's open all the time, and it does get looked at all the time. Obviously, there's no guarantee that if you submit a topic, it will lead to a call for research. Equally, a number of topics get merged into other topics, or etc. So it's not sort of a nice linear pathway, and there's no guarantees. But there is that route into an NIHR if, as an individual, you want to submit a topic in for consideration. So in terms of what we do that sort of brokering bit between the evidence users and the evidence generators. So we want to make sure that we're asking the right questions. So we do a lot of work with key customers such as NICE and our colleagues in the devolved administrations, colleagues in public health as well, to really understand where their evidence needs are. And then from our point of view, try and turn that into tractable research questions that we can then put out to the research community. We try and do that, essentially offering that sort of translation service between taking the need and trying to turn it into a research question. But it's really hard. It's tricky. Some of these questions take us a long time to work out actually how we're going to address them. Sometimes there are no right or wrong answers, and actually we don't have all the answers, so we're not expert in absolutely everything. So a lot of the time, in fact most of the time, we go out and we speak to experts in the field, subject matter experts, methodologists, to get their input. So most calls that go out from an NIHR point of view have had a lot of external input as well. And as I say, and sometimes we just actually think it might be better to put it out to the research community and see what they come back with, rather than us trying to over specify. So you will see in a number of research calls that go out, we ask researchers to specify and justify, and that's because actually genuinely we want to see what the research community will come back with, and we want to see how the research community will address a particular issue, rather than us, particularly being the non-experts, maybe dictating and maybe coming up with the wrong answer. So that's why you see that in a lot of our commission calls. So last couple of slides and then I'll draw to a close. So I think from an NIHR point of view, the commission workstream is hugely successful. It's definitely a USP of NIHR, and there's some really impactful studies and work that's come out through the commission workstream, but it is hard. It's hard to develop those tractable research questions, particularly the number that we need to commission each year. And I think a lot of the low-hanging fruit is definitely gone. Co-production is really positive, but again, can also be tricky in terms of managing expectations. So when you're working with a key customer, it can be challenging sometimes, particularly in terms of timescales, when they need an answer much sooner than you're able to deliver, or trying to commission research that's all encompassing and so broad that actually it's not going to be helpful. So again, it can be a bit of back and forth between the customer and NIHR to really get to that common ground in terms of what's doable and achievable through research. I think one of the challenges we have all the time is about the duration and the time it takes us to commission, and I think we're very aware now that there's lots of evidence needs, and us saying, okay, great, well, we'll take that and we'll come back to you in 5 years with an answer isn't particularly helpful. We've talked about feasibility, answering the question, research and capacity again. So some of the earlier slides I talked about NIHR strategic priorities in terms of building capacity in particular areas is directly in response to that need to be able to commission more research, but you've got to have the research capacity to do that. So it's a bit like a sort of chicken and egg. And obviously defining importance, everything is important. How does NIHR then start to really think about how you start to put more granular approach into that sort of importance assessment, and what needs to be advertised sooner rather than later? So it's tricky. It's really tricky. When it works really well, but it's not without its challenges. So there's lots of things we've been doing, trying to think about how we continue to evolve and adapt the commission workstream to make sure it sort of maintains its relevance and its impact. So lots of different things. So we've now set up rapid evaluation teams that some of you may have seen through some of the programs. So these are much more fleet of foot ways by which NIHR can do those rapid evaluations, rapid evidence reviews. Some of you may have seen application development awards in certain areas. So again, where we think that we might need to give a small amount of pump priming money in the first instance to help drive a field forward rather than expecting full-scale evaluations to happen. And highlights against particular areas. So again, we're trying to think about how we can keep that sort of commissioned work stream relevant and meeting the needs of those customers, whilst maintaining that challenge that we always have about NIHRs there to generate high quality evidence that stands the test of time, which is really important and really integral to our mission. But equally, if we want to meet customer need, you sort of got to find that common ground, and how do you do that? And so that's why some of these new approaches have been taken. So just last couple of slides. So essentially, we're all the time trying to think about how we're evolving and adapting, and we're working in a system that's changing around us. So nothing stands still for long. So again, we're very mindful about the system changes going on. And obviously in England, we've had the integrated care systems come online. There's still, I think, recovery from COVID that's going on, and system recovery and winter pressures. There's newly formed bodies, cross-government bodies. So again, sort of just recognising the world in which we work in, and that changes, and how do we sort of keep that relevance and reflect those changes that are going on around us. A lot of the work we do now is higher risk, in terms of these are really challenging questions that we're trying to ask, which means that these projects have a higher risk of failure, higher risk of non-delivery, and of people, and particularly the Department of Health, is there the appetite for that? And I think there is, but it's something we have to bear in mind. How do we prioritise that capacity versus demand? There's, you know, we've got a very healthy budget, as I said right at the start, but we don't have money to do absolutely everything. Managing expectations, we already talked about a little bit. And how are we proportionate? So how do we do that sort of agile commissioning in a proportionate way that meets the needs of our customers? So these are the things that we're sort of grappling with all the time and thinking about, and how do we sort of make sure that how NIHR commissions still is delivering for the key customers and delivering the overall mission. And so I won't dwell on this, I think we already talked about it, but just things that we're doing to think about new approaches, so partnerships, awards, pathway grants. So again, you might have seen different types of opportunities going out through NIHR. So again, this is about us trying to, I say, keep relevant and keep abreast of the changes across the system. So, and I'd expect to see more of it. So again, I think there's still a place for the RCTs and the standard sort of project program grants, but again, you'll start to see a much broader menu of commissioning options now coming out from NIHR, which I think is a really positive thing. So hopefully more opportunities and to commission that high quality research, and more opportunities for different parts of the system to get involved as well. So that's my slides. So hopefully helpful in sort of, I guess, setting the scene a little bit in terms of the commissioning and what NIHR is looking for. So I haven't managed to keep my eye on the chat. If there's any questions, I'll stop sharing, and then happy to pick up any questions. So I'll just stop sharing now.